Studies show that patients who are actively engaged in their own health care have better outcomes and lower costs. But as many as 40% of Americans lack the skills and the confidence to be this kind of model patient. Now a new tool called the Patient Activation Measure, or PAM, is empowering people to participate in their own health care and to get healthy. Informed Patient columnist Laura Landro is here. She's joined by Dr. Judith Hibbard, who developed PAM. I want to start with Dr. Hibbard first. What about the current healthcare system made you recognize the need for a program like this?
Well, patients' behavior is really important in determining outcomes. And right now, we usually just pay attention to their clinical profile, but we need a way of really understanding patients' readiness to take on the role that we're asking them to take on.
How does PAM work? Who is a typical PAM patient?
Well, it's 13 questions, statements that people might make about their health that people can agree or disagree with. The math behind the measurement tells us that we're actually, even though we're asking 13 different questions, we're really just measuring one underlying idea. And we think that underlying idea is a person's self-concept as a manager of their own health. And that's why it's predictive of most health behaviors.
Okay, Laura, I want to bring you into this discussion. As someone who has a column dedicated to informing patients, give us a sense of how hard it can be for some of these patients to take full control of their own health care.
Well, I think a lot of us who are very health literate or people who are very well educated or have lots of, good support systems don't see this as a problem. But in fact, studies show that as many as 40% of Americans don't have that skill, knowledge, and confidence to be an activated patient, and then the next step, which is to become engaged in their own health care, to become engaged in the system. And that's what a lot of healthcare providers, PAM is one of the many things that healthcare providers are doing now to try to get a bead on these people and then figure out what you can do to help them.
Studies show that PAM reduces patient costs and their risk of being readmitted to the hospital. Can you tell us something about that? 'Cause that's
well, it's been used,
interesting.
Readmissions in hospitals is a huge problem in the healthcare system today because you have so many people heading right back into the hospital within, 30 days of being discharged, and Medicare is now starting to penalize hospitals for that. So the idea is if we can figure out what they need when they're discharged, figure out what level of activation they're at, maybe we can do more to really get them better prepared for what happens when they leave the hospital. And that's the idea. Figure out what level of activation there are, and there are 4 levels. 1 is you really can't handle it. 4 is you can handle it, but stress may make it harder. So once you figure out what their level of activation is, you can design those interventions and custom tailor things for them.
How many hospitals, insurers, and employers are actually using PAM? And are there any plans to expand that number?
Well, it was developed at the University of Oregon. It's since been licensed to a company called Insignia, which has been out there for quite a few years. They're not very high profile, but they're kind of plugging away at getting more systems to use it. And you've got more, big, like WellPoint, which, as you know, has a lot of health plans, Blue Cross Blue Shield, companies like Roche, a lot of different researchers are using it. And it's kind of getting out there and getting more into systems of healthcare.
All right. Well, Laura and Dr. Hibbard, I want to thank you both for coming on the show. Really good stuff. Thank you.